why is this dog limping? That's why. Ever experienced that? A knee that's bummed out, really painful. It's happened to me about a little less than 2 years ago with my dog. It is the most excruciating thing that you can find in your life when you have your pet, as a pet parent, when your dog is in pain and it's the knee and you see that limping. You don't know how bad it is. You don't know what's going to happen. Your dog can't talk, but boy, when they're limping, you know something is wrong. It is the worst sensation as a pet parent. And I got to tell you, when this happened to me, the first thing that went through my mind is surgery the only answer to fix that knee? I don't know how bad it is. Well, I got to tell you what I did. I turned to some of my really good friends, experts, and I've got one of them today. Actually, that literally helped me with my dog. And this expert is not just a physical therapist, it's a doctor in physical therapy. And it's also somebody who has expertise in pain management. So you are in for a treat. We're going to find out what can we do, what are the alternatives, what are the key tips that we need to know when this happens to your dog. So I'm super, super stoked and excited to bring a really good friend, somebody who's an absolute expert on the subject, somebody who does rehab constantly. I said, this is a doctor in physical therapy and pain management. And when this person comes on board, I want you guys to give her some hearts. And also, here's the deal. You're going to hear a lot of things, some that you already know, some that you're going to learn. And when you learn something new, do us a favor. In the notes, do some paw love, hashtag paw love. And then whatever you learned, because it's a great way for you to share what you've learned. It teaches us what's important to you. And it's also an opportunity for you to tag somebody else so they can learn about it as well. And by the way, for all of you folks that do the hashtag paw love in the notes below, we're going to do some giveaways of one TDC over the weekend. So I'm really excited. So before I get started, here we go. Dr. Toracca is the person I'm going to bring on board right now. Here we go. She's coming up. Magic. Hey, Dr. Toracca, thank you so much for joining us.
Oh, thank you so much for having me. And this is just such an incredible topic. And it is, as you said, probably most dog owners have seen a dog limping or their own dog. I have 3 dogs of my own, and I've definitely noticed limping, and you have that initial panic. And like you had said, I live this every day in my clinic. And I think so many people think, oh gosh, my dog is limping, it needs surgery. And I always try to talk them off the ledge, because there's so many things that we could do before or to avoid surgery. And that's always one of the goals. I am huge about conservative care. Yes.
And I remember we were at the STAR Symposium together.
Yes.
And I brought you my dog, and she was limping, and I was like really hard. I didn't know how bad it was, and I didn't know what we were going to do. But I want to talk about you just in a second, just before we go into the knee aspect of it, because you have a clinic. Where's the Paws? Really cool name.
Thank you.
And tell us a little bit more about your background. I know you have a doctorate in physical therapy. You have an expertise in pain management, which is huge for that as well, because what do you give your dog in parallel to whatever you're doing? So tell us a bit about your background, how long you've been doing this, for some of the folks that may be on that actually don't know you.
So I have been, every time I count the years, I think, oh gosh, I'm getting old. But I've been a physical therapist for a little over 30 years.
Wow.
And working with small animals and some large animals for now over almost 25 years.
Wow.
And as you said, I have my clinic, Wizard of Paws. We're a busy clinic, and it is awesome. I always say that I learn something new every day from the dogs I work with. And the philosophy is always the best quality of life for the longest time possible. And when I talk to owners, we want that dog to live the best quality of life. If we can, we try to avoid surgery at all costs. And coming from the human background, we're always going to try conservative measures before cutting.
Right.
And the same thing with dogs. I see so many owners that are kind of rushed into surgery, and you could always cut, you can't uncut.
Right.
So, and if we follow the whole philosophy, best quality of life and looking at reducing pain and inflammation and improving strength, especially if the dog has a bum knee, there's so many things that you can do before jumping into that surgery.
All right. Well, let's get into that. And I also want to, for those of you who just tuned in, this is Dr. Toracca. She's a doctor in physical therapy and pain management expert. And if you tune in, also do know that you're going to want the show notes of what we're going to be discussing. And when you, very simply, I'll put on the screen so you guys can actually see this. If you go in the notes and you actually put the word knee, it's going to get you captured so that we can provide you the show notes. But more importantly, too, there's some really nice. So Dr. Toracca was very generous. She decided that she wanted to help. And she knows a lot of you guys are experiencing what I've experienced with my dog. So she's providing a free virtual consult. So make sure that you go down below, give her some hearts, and also hashtag the word, you don't have to hashtag, just put the word knee. And also you'll get some 1TDC coupon as well. So let's get into the subject. So the first question I have for you is, as far as cruciate disease, that's another way I've actually heard you talk about it, Dr. Toracca. How common is it? Is this like a really common disease, and how often does this happen?
Sure. And cruciate disease is super common. And we look at things that predispose a dog. And many of you may be saying, oh, that could be my dog. So we look at a dog over the age of 5, if they've been spayed or neutered.
Okay.
If they're a little bit overweight. So that is definitely leads to more issues. Certain breeds are more predisposed to cruciate tears. And a lot of people think, if you think about the human side, a person will tear their ACL or their cruciate acutely or abruptly. So I always laugh. We hear about people say, oh, it was the last run of the day while skiing and they tore their ACL. Well, of course, it was their last run of their day because they tore their ACL. It's more abrupt. In a dog, it's more of a chronic issue that keeps going. So the dog may be running around the backyard, chases a squirrel, comes back, little limp. And I always use the analogy with my clients. If we think about the strands of the ligament together, like almost like 2 paintbrushes. And what will happen is there'll be an initial tear. And so there's a little bit of a tear and it creates a little bit of instability in the knee. And then maybe they're running around more and they're playing with their dog buddies and another one tears. And then another strand goes and this happens. So it's been going on for a while. And then the dog goes and, does something crazy, jumps off the couch and pulls up lame. And so it will differ from people in that it's more of a chronic process. And if a dog tears one side, they have a 40 to 60% chance of tearing the other side.
Wow.
So I know whenever we're looking at rehabbing and encompassing everything, we're addressing both knees.
Both sides,
so, yeah.
So it is very common, and as you're explaining to us, there's a progressive aspect of it. Now, let me ask you kind of a question in relation to that. While it's common and there's this progressive chronic tear that's happening, does as pet parents, we always care about the feeling, the emotions of our animals. Are they in pain even with those micro tears, or is it just when you have more of a subtle, more rupture that's taking place?
Yeah, great question. Because I think dogs are so good at hiding their pain from us.
Yes, they are.
They try to put a brave face on for us. But if the dog is not putting weight on it, I always tell people, if you're not putting all the weight on your leg, you're hurting, whether it's from a blister or knee. So there is some degree of pain. And then what happens when there's pain, the muscles start to weaken. And this becomes a vicious cycle. So they weaken, become more painful, all of that sort of stuff. So
that makes a lot of sense. So if you just tuned in, we are with Dr. Toracca. She's talking to us about knee injuries. What do we do? And are there alternative solutions, or is surgery always the solution? So if you tune in, don't forget, you're going to want the show notes. She's giving a virtual consult as well. Put me down below in the notes section. So let's talk about the surgery aspect of it, because as you know, I was faced with that exact same question. If the dog, does not need surgery, then what can I do?
Sure. And there are a lot of reasons a dog can't have surgery. And there's some dogs that can go right into surgery, but I always say, let's pause for a moment. Let's try what's called the multimodal approach. So
Got
we
it.
want to decrease pain and inflammation, and if we look at some of the tools that we have, I mean, certainly decreasing pain, there are so many things to do, from pharmaceuticals to laser to a CC loop. Certainly, looking at something like one TDC that we know will promote healthy anti-inflammatory factors in there. And simple things like ice. I always joke, no one's going to make money off of ice, but it's probably one of the best anti-inflammatories. And what we want to do while we're decreasing that pain and inflammation is improve function. So ligaments, I'm sure most of us have experienced this at some point in our life. If we've had way too many cocktails, maybe a college experience, and you twisted your ankle and you sprained your ankle. Unfortunately, those ligaments never come back as strong. So if you twisted your ankle in college, sprained your ankle, that will haunt you the rest of your life, unless you work on balance exercises.
Got it.
So the cruciate ligament. So we really want to work on balance. And the goal is to try to get some stability there. There are definitely some deal breakers, certainly if the dog is in too much pain or if there's a meniscal tear.
Got it.
So from our rehab standpoint, I like to look at 2-week increments. Are we improving? And then it's also a modification of lifestyle temporarily. So no chasing squirrels or frisbees or balls or anything like that, and putting stress on that knee.
So that's a really important one, what you just said. And guys, if you just tuned in, great information. Definitely down below, hashtag some pod love of things that you learn, so we can learn what you're learning as well, so we can expand it into the blog that we'll put together from the show notes. But you're saying there are some deal breakers, and I'd love for you to circle back on that, because I think that's really, really important. Because I think all of us as pet parents, our first reaction is, I think you've qualified that not all dog will need the surgery, but there's some deal breakers. So do you mind just recapping a couple of those?
Not at all.
It's clear for everyone.
Because it's definitely when we look at the deal breakers, if there's a meniscal tear, there's a biomechanical issue, that knee will not heal. And usually we know that pretty quickly. If the dog is in severe pain, because we want them out of pain, that is going to be a deal breaker. And I also honestly tell owners during this period, if you can't control your dog, then we're not going to be successful. Like if you have to play ball with your dog, you're going to keep breaking your dog, and it's limiting it until that knee gets stronger and then progressively getting back to it. So
a lot of
there.
patience, and depending probably on the temperament of the dog as well. Because to your point, some dogs, I mean, a lot of my friends in the canine sports world, very high.
Yeah, exactly. But then you think, and I always tell owners, if you can't control the dog before surgery, can you control them after surgery? So all these things to think about. And then we think of what we need to do, what we can do, a lot of mind games, that sort of stuff to keep the dog active and, from not going crazy and the owner not going crazy.
Yeah, that's really good insight. Thank you on that one, Dr. Toracca. So if you've learned something, go down below, hashtag paw love if you just tune in, so that you can be in our drawing giveaway, but as well, so we get to share what you've learned. So just hashtag paw love down below. Now let's go a little bit into understanding a little bit more in the details of what exactly is conservative care, because you've talked about that a little bit. And if you determine based on what you said that I could potentially not have the surgery, but go into the conservative care, what am I looking at? What exactly does that mean?
Yeah, in conservative care, we're going to look at, again, reducing that pain and inflammation. So whatever we can do to do that, and gradually strengthening the dog. From a rehab, if the dog was in our clinic, we would do various things such as laser, maybe pulse shockwave, underwater treadmill, lots of core work, and therapeutic exercises. At home, It's just as important what you do at home for the dog. So the
Mm.
first thing I really emphasize is movement is always quality over quantity. I hate to say go take your dog on a 20-minute walk because your dog may only be able to do 10 minutes and
Right.
then they're lame. So if the dog is limping, we're going to assume pain. So, and walks are great. The only thing we want to avoid is downhill in the initial phases because that puts a lot of stress on the knee.
So
So,
downhill is harder on the knee for the dog. That's really good insight.
correct. Yes. And the
Yeah.
same with stairs. I always ask owners to, functionally, if you live on the third floor of your apartment, you have to go up and down stairs, but try to minimize it and slow it down. So some of these high drive border collies, they fly down the stairs, and that puts a lot of stress on that cruciate. So trying to minimize that. And if you do have to come down a hill, zigzag down a hill instead.
Ah,
So,
excellent.
because,
Whoa, good.
yeah.
We got to see some hearts on that one. This is good insight. The zigzag, I never thought about that. So,
Yes.
yeah, let's give Dr. Toracca some love, guys. This is really good insights for us. Excellent. So be careful going down the hill, going up the hill, going up or the stairs. But if you do have to have those motions, then zigzag it. So there's, I guess,
Right.
less pressure on the knee.
Correct. Yeah.
Got
And
it.
going uphill is great to build up the hamstrings and the gluteals, but we just, again, have to be careful. And then my
Yeah.
rule of thumb is the dog, if they're tired 4 to 6 hours after your activity, that's legal.
Okay.
Anything beyond that is illegal. You did too much.
Got
So,
it.
with my clients in the clinic, I'm following up with them, making sure if they were tired after, that's okay, but it shouldn't go into 24 hours. And,
Got it.
making sure no limping, no lameness.
Got it. So don't overdo it, either yourself or for your dog who's hard driven. And then
Right.
if some limping comes back, then you're pushing too hard.
Correct.
Got it.
Yes.
Yeah, really good insights. All right, let's go into some more of the details about what are the components for a home program if your dog has cruciate disease? Because a lot of it, we will come down to a clinic like yourself. We'll get some rehab treatments, but the next question is that enough? Or how much is expected from me as a pet owner to really take care of the recovery? Because we wish you could just stay with you, but that's not going to be possible.
Right. And it's definitely, I tell owners, you have a lot of homework and it's important to do. And as I mentioned, I think one of the best exercises to do is walk, walk your dog, is great. And you could do that twice a day. Again, quality over quantity. So some dogs can go 3 miles and they're fine. Other dogs will go 5 minutes. The other thing is lots of balance exercises. So something as simple as having the dog stand and look up transfers weight onto the hind end, and that will start building up their rear. So if you are a kibble feeder, I encourage people to take 10 pieces of kibble out before they feed their dog and hand feed them 10 pieces and having them look up. And that
Got it.
transfers weight. And walking backwards, if you could teach your dog how to do that, that's a great exercise to engage the hamstrings and the gluteals. And then also adding a lot of balance exercises. So things like unstable surfaces. And again, remembering that ligament, the cruciate is a ligament, and we want to strengthen up all the balance aspects. And then the big thing is control. So I tell owners, if we can control the dog 50% of the time, we're doing okay. If we can prevent them, again, that downward movement. So jumping off of furniture is not good. Sliding on hardwood floors or tile floors, not good. So without completely altering your life, what can you do? And then the other thing I always say to owners is we have to watch their weight, because if we have reduced activity, we need to reduce their food intake. And that always becomes an issue.
That makes sense, because that was a big fear, and a lot of our folks in our audience have very athletic dogs. And when you cut down, and I experienced that with Sacha, she loves to do the frisbee, and she's super fit. That was my worry, is that if I reduce the activity, do I decrease the food? But I also want to, her to recover. How do you balance that out? How do you know how much to reduce and not reduce based on activity?
And it's so tough because you want to make sure they're not gaining weight, but you want to make sure they're also getting the protein that they need to build up the muscle mass
Yes.
because, so it's a balance. And, of course, in the clinic, we could weigh them, but if you have any ability to weigh them or just take a tape measure and measure around their stomach. So we'll
Mm,
measure their waist to make sure that they're not plumping up.
wow.
And
I never
that's,
thought about that.
yeah, an easy thing to do, like we would do with people, look at their waist measurements
That's
and
a really good insight.
so to
Um,
look at that.
I actually did not do that with Sasha, but that would have been a really good idea. So, good insight. Can give some hard to if you just tuned in with Dr. Toracca, expert in doctorate in physical therapist, and she's also a pain manager. Just give us a great insight. I probably need some hearts and some Paula on this one. What to do with your dog? And one of the things is to actually measure the waist. That's like brilliant.
Yes.
Never thought about that. So they're
And
not
don't
gaining weight.
cheat.
And don't cheat. No, the dog might want to cheat.
Yeah.
Excellent. Now let's go into an important question as well. Is you talk about conservative. What are some things that I can do from a conservative standpoint at home? Because I think probably in what I experienced with Sacha and in learning from you as well is you don't go all out initially. There's really a progressive aspect of
Mhm.
it. And is there kind of a step that you could kind of walk us through? It's like initially, get your psyche of what to expect, what to do, what
Mhm.
not to do again, and then what is that progression of a conservative care is going to look like?
Yeah, because we definitely want to, when dogs normally put 60 to 70% of their weight on their front legs, 30 to
Mhm.
40 on their rear. So sometimes it's hard to see if they're limping or not. And if you're not able to tell, one of my little tricks is to get some nice red nail polish or pink nail polish and paint the bottom of the dog's nails and the top and let them be for 24 hours and then look and see, are they evenly worn out or
Wow.
is one side not, because sometimes it is difficult to see, especially if you have a hairy breed like an old English sheepdog or something like that, a little bit more difficult to tell. um, but
Great.
I always
I got to stop. What a great tip. I never thought of that. So not only do I measure the waist, putting some nail polish on
nail
the tip
polish.
to see what's
Yes.
being worn out, to see what pressure is going in. So don't forget, guys, this is a great insight. You're going to want the show notes of this. If you just tuned in, there's a lot that you've already missed. So Dr. Toracca, thank you for that info. And if you want to get the show notes, and by the way, if you just tuned in as well, we're going to give not we, Dr. Toracca is actually giving a free consult, virtual consult. All you have to do to be entered for that, down below in the notes, just put NE, N, not N, KNEE, so that you can enter for that. You'll get the one TDC coupons as well, and you will get the blog and show notes from this particular event. So awesome. Sorry to interrupt you, but I thought
That's
that was a
okay.
really good tip.
Yeah, I always love the nail polish.
Yeah, it's a great
um,
one.
Yeah, so we'll look because the steps are once the dog starts to feel better, again, that multimodal approach. So we're decreasing pain and inflammation. And the decreasing the pain and inflammation can be brought on many ways. Like as you know, one TDC, that's always part of this component here.
Mhm.
And then we look at any other supplements the dog needs, anything to reduce inflammation from ice to laser to a CC, animal health, that sort of stuff. um, as the dog starts to feel better, we're going to see less limping, more
Mhm.
movement, more energy. Um, so I always like owners to keep track of their walks. Again, if they're able to do, set, everyone's got iPhones or smartphones, set the time, how much do they walk? And as they start to progress, each day moving a little bit further, going and everything is going great. So we're just constantly trying to increase to get back, to their normal activity.
How much increment should I do from a walk standpoint? Like if I'm able to walk for 5 minutes, and
Hmm.
it's fine, and there's no limping, it's been
Yeah.
48 hours and it's fine. Do I go 7 minutes? Do I go 10 minutes? How do I gauge that progress?
Such a good question. So it will depend upon the dog and the starting point, but I'll usually say 10 to 20%. So with our older dogs, for example, if we can walk 10 minutes, then push it another minute the next day. Your more active dogs, like Sasha, we're going to do 20%. So
Got it.
12 minutes. Okay, that's good. And try to go. But all the time realizing that the dog could have a bad day, and it's
Mm,
okay that, they're having an off day. So don't push, pull back, because again, that quality over quantity, so important that listen to that. And
got it.
it's, and as they start getting stronger, we'll see more endurance.
So let me ask you, because one of the things I did experience with Sasha with her CCL tear was I was doing the conservative aspect of it, and when you see improvements, you get really excited,
Hmm.
and the truth is, there are times when it reverted back. So
Yes.
when that happens, what's the best thing to do? Is that you decrease the amount? Do you not do the walks for a day or two? What's the
Yeah.
best way to approach that?
And it's a really good question, because it is very common that, dogs are going to have minor setbacks.
Yeah,
So it's okay. It's not the end of the world. We're just going to pull
it
back.
feels like it's the end of the
I
world.
know, I know. And I think I told you I had a major knee surgery, and I think, oh, and I did it on Sunday. I walked a mile. I was so excited. Monday, I was feeling great. And by Tuesday, I was hurting. So I pulled back and said, okay, some more ice. I'm going to take it easy. And it does come back, so, but it's important to rest, go back to our reduce the inflammation, reduce the pain, and then continue moving forward. Because
Mm.
I think hiccups are very common. I mean, again, the dog doesn't know that they're not supposed to chase the squirrel outside or chase
Mm.
leaves or anything. So stuff happens with them.
Yeah, we've got, thank you for that. We've got some good comments coming in. So thank you, Rosemary, for the Paulov. She mentioned quality over quantity, one of the key things that you mentioned. I
Hmm.
think we have a question from Lynn. Let me just show it on the screen so you can see that. Does the weather bother them like it seems with some people with joint injuries? It's a great question. It never seemed to bother my dogs, but that's a
It
good
does.
point. Thank you, Lynn, for that question.
Lynn, I definitely see it. So I know that with either the very dry weather or the very humid weather, dogs are just a little bit off. And again, with the humidity in the air, inflammation is not going into the environment. So I definitely see it. So it's
Mm.
important to respect that. Again, I'm living it with my knee. So I know when the humidity kicks in, my knee is hurting, and I see it with arthritic dogs. And so definitely, very good question, Lynn. Thank you.
Thank you, Lynn, for the question. One of the things I was going to share with you, because I've learned from experts like yourself, because I know that you do use the one TDC in your clinic.
Hmm.
What's fantastic in the way that really experts like yourself do, you really double up the loading dose a lot of
Hmm.
times during the initial phases. And the thing that's amazed me too is how you guys have used it topically as well,
Hmm.
cracking the soft gel in the area. I remember you even told me with Sacha, in like the sartorius muscle to make sure that I
Yep.
put some in there. Of course, where the knee was, but part the hair and put it on topically. So that was also an
Yes.
inside tip that we've learned from pain management experts like
Yes.
yourself.
Yes. And that it highly recommend that, works fantastically. So.
Excellent. Excellent. One last point that I want to talk about is in the conservative care. As I mentioned to you, for Sasha, one of the key things by your recommendation and also some of your peers, I got a brace. So if you
Hmm.
could tackle that subject a little bit, in my case, I got a fantastic brace.
Yep.
I would say I was very pleased with it. I still use it, even though Sasha is completely recovered. I still use the
Yeah.
Go Hero brace.
Yes.
Fantastic, fits perfectly. It's a little bit more work in the beginning getting it right, but boy, it's like it reassures me even now when she goes out playing frisbee. So can you talk to us about the brace? Why should I get a
Absolutely.
brace and the whole
Yep.
topic?
And with bracing, like, I honestly tell people, some dogs do great with it. Others will eat it. So you have to have like the right mentality. But and they're not a one size fits all like people. Like, so if anyone has torn their ACL, there's a lot of off the shelf sorts of things. And like you experience with Sasha, we have to be very careful because they can't tell us there's a little bit of pressure here, or, but what the brace does is help minimize the movement in the knee and let the body begin to strengthen. So initially using the brace until the dog is really healing, and then weaning them off. And
Got
as you said, sometimes it's more for us, because if they're out running,
right.
that brace is going to help prevent them from causing stress on that knee. And finding a great company, like the Hero Go Hero brace is so important to look at that, because we want a good fit. We want to make sure as the dog's muscles are growing that the brace accommodates them. So
Yeah, that's
yes.
it. Probably on that note, it's probably best to get it right away before the
Hmm.
muscles actually atrophies just a little bit before building it back up.
Right, absolutely.
Yeah, no, it's made a huge difference for her, and it's true. She wasn't biting it, but she didn't
Hmm.
like the sensation of having a brace on.
Yeah.
But the truth is, I distracted her with the stuff that she really loved doing, which was even
Yes.
walking with her frisbee. Although I couldn't throw the frisbee, but it was anything that could distract her. And I thought something was wrong with the brace, and I realized no, it's just she's
No.
super sensitive. But
Yes.
if
And it's definitely, some dogs don't tolerate it. So I always say, before you spend the money, make sure they're going to be okay with it. But others do absolutely great. So
got it.
yeah, yeah.
Good. You've covered a lot of ground. And if you've just tuned in, folks, this is Dr. Toracca. She's telling us and sharing with us that your dog's got a bum knee. Surgery could be, but there's also alternative at times. And I think we're probably at the right time now. What I'd like to do is do a really nice recap for folks. In the meantime, if you've just tuned in, make sure that in the notes you put the word knee. Why? Because Dr. Toracca was very kind enough to provide us a free virtual consult. One of you guys is going to win this. You're going to get the show notes as well, and you also get some of the one TDC coupons that are going to come your way. So let's start from the start as if it was the very beginning, and I'll introduce you again so that we can go over your key tips, which will be
Perfect.
really a good takeaway for everybody. So this is magic. We're starting all over again. You ready? Okay.
Ready.
So your dog is limping. It's got a bum knee. It's really bad. Your dog is in pain. You don't know to what extent your dog is in pain, but you know something is just not right. It's going to need attention from an expert. Well, I tell you, I experienced that, and I was so fortunate to have Dr. Toracca, who's with us today as an expert in physical therapy, for which she has a doctorate in it. So really studied the subject very, very deeply. She's been doing this for over 20 plus years, 25 years, she mentioned. And also she is a pain management expert. So I realized that there are some alternatives. You don't always need to have surgery, as you have shared, but I really want to know, what are the key takeaways about what do I do with my dog that's got a bum knee? So I think we have a top 5, a top 6. If you could go ahead and kind of lay it out for us. What do I do next?
Yes, absolutely. So you're faced with a bum knee, your dog is limping. So first you want to make sure you get a good diagnosis and make sure it actually is the knee. Then we look at conservative care. And the conservative care is going to encompass what's called the multimodal approach. So we're going to decrease pain and inflammation while we're concurrently improving strength, balance, and function.
Got it.
Very, very important.
So number
Um,
one, conservative, get the diagnosis. Number
yeah.
one, get look at conservative care with multimodal approach. Got it. Okay. What's tip number
Perfect.
2?
Number 2, lameness or limping is not okay. Your dog is not going to come to you and say, my leg hurts. They're going to not put all their weight down on that leg. So if your dog is limping or lame, you're going to assume pain. And that's going to be your stopping point or your get help point.
Got it. So point number 2, limping or lameness is not normal. Something has to be done. Excellent.
Absolutely.
What's tip number 3 on how to handle that bum knee?
So some deal breakers that are just, we're going to require more attention. If there's a meniscal tear, and this goes back to getting the right diagnosis, the dog is not going to be able to heal conservatively. If the dog has a change in pain, so one day they wake up and they're verbalizing, they're screaming, that is a deal breaker. And also, if the dog significantly decreases their activity, they're not walking, your dogs. If something is off, that's not normal. So those are the deal breakers.
Got it. Okay. Deal breakers is number 3. Tip number 4.
So tip number 4, I always say you can always cut. You can always have surgery, but you can't uncut. So always think about that. You know, in human medicine, we try conservative first.
Got it.
So important to think about that.
Yeah, that's a good point. Once it's cut, it's cut. Once surgery has been done,
Yep.
it definitely, yep. How about tip number 5 for us? Bum knee. What do I do? Tip number 5.
So tip number 5, we're going to go back to that multimodal approach. And I repeat this over and over. We're going to reduce pain and inflammation. So you look at the things that you can do. You can take your supplements. You can apply the 1TDC onto the knee area. All of those muscles, so helpful, because as we're reducing that pain and inflammation, the muscles are going to work better. So that's going to be our balance.
Excellent. And let's do an extra one. Tip number 6, bum knee.
Yes.
What do I do?
Your dog cannot get fat. So proper weight is such a key. If your dog is starting off overweight or a little bit extra fluffy and they have a bum knee, you really need to work on reducing the weight. And reducing the weight sometimes is like magic. It will help reduce the stress on that knee, and that'll help. So your dog has a bum knee, working on reducing that weight safely.
Excellent. And really balance that out because of the decreased activity to reduce a little bit of the food. Yeah, that's an excellent point. So we want to thank you. We're very, very thankful that you were sharing all of your insights and knowledge. If you just tuned in and you want to get all of the recap, make sure down below you put the word knee in the notes. That will enter you to get the show notes. And someone is going to win a free virtual consult with Dr. Toracca. So that's pretty neat. And you'll get some 1TDC coupon. And as a matter of fact, if you want to give some last paw love for Dr. Toracca, just hashtag paw love, and you will get entered to win a 1TDC bottle. So I really want to thank you. First, I want to thank you. Really, I was so thankful that I was at the STAR Symposium and have you watch Sacha initially, because you know, some people, sometimes it takes days. And when you see that dog in agony, I was very, very fortunate to be in the middle of experts and to have you look at my dog and getting that consult right then and there. I was very, very thankful for it. And she's done really well. She never did get cut. She does not limp. She can go, she's 10 years old plus now, and she does her a frisbee, and she's super happy. I just keep the Go Hero brace on her and the 1TDC. I keep her on the loading dose. But we really want to thank you for all of the knowledge and the recap, and we look forward to speak with you very soon again.
Yes, thank you so much. Have a great day.
All right, we will see you next time.
Sounds good.